We're now going to go to the next panel. Unfortunately, you lost half your time because the commissioners asked too many questions, but we'll bear under the pressure. So Catherine O'Regan is Assistant Secretary for Policy Development and Research in Housing and Urban Development. Evelyn Kapler is the Director of Office of Adolescent Health, U.S. Department of Health and Human Services, who just released a spectacular evaluation. I hope you tell us something about that. And Matthew Klein, Executive Director of New York City Center for Economic Opportunity. Catherine, you're first.
Great, thank you. And good morning, and thank the commissioners for this invitation. Collecting, analyzing, and using data and research to inform HUD's programs and policies is the core function of the Office of Policy Development and Research at HUD, which I direct. And like many federal agencies that you're hearing from, HUD is focused on learning more from the data we collect and more from the research we conduct. And we believe that to make the most of the government data and fully leverage how the data can inform policy, we do need a leap forward by making our administrative data much more widely available while protecting privacy, by matching them to other data across government agencies, across levels of government and non-governmental data. Linking is particularly key to expanding cross-domain work. Housing has big impacts on non-housing outcomes, so for HUD, this has been one of the areas we're very focused on. And also by ensuring capacity of governmental agencies to leverage the linked data to conduct in-house research, which is part of my answer to your question about getting answers faster. The Evidence Commission's charge is kind of the invitation to make that leap now. So I'm going to talk about some of our efforts to give examples of lessons that we think would be really useful for moving forward. We've been focusing a lot on cross-agency data linking, and I want to talk about two efforts here. The first is an effort that we actually succeeded on this year, which is to sign an MOU with the Department of Education that allows HUD to provide the Department of Ed with data on assisted tenants for matching to federal student aid data on application and receipt of federal student aid. This now gives HUD the ability for the first time to have national data on one proxy to measure college attendance for those we serve. The matched data have enabled us to, for us, the first time do a large-scale rapid cycle in-house experiment because we've got the matched data right in-house. And we're also able to provide aggregated outcome data to public housing agencies, which some are going to use to evaluate their programs. They don't have those data. We can do it in an aggregated form. So it goes immediately into program evaluation. Some lessons from this experiment. The linked data are not located in a secured research center. We get an aggregated batch back. We can process that and do some things with it. We can't delve in, go deeper, and go inside a center to ask different questions. So the infrastructure is lacking to make the most out of this effort. Our second effort we've been working on for quite some time. We have with the National Center for Health Statistics, we have an MOU and we have linked HUD longitudinal data to 14 years of cross-sectional health data from 2 national surveys. These linked data mean that researchers can look at the effect of housing on a collection of health utilization and health outcome data. And we've done benchmarking. We've now re-upped and extended the MOU so that we have a 3-year cycle going forward. And we already have research coming out of this. The CDC Research Center provides the infrastructure that was missing from our previous MOU that we don't have with the Department of Ed. They have the ability to do linking in-house, and they have the ability to secure privacy. The MOU that we signed means that the CDC will do that linking free. HUD geocodes all their data in our geocoding center free, so we've actually got a structure that is financially feasible. And one thing to be thinking about as we move forward on data linking, and we're running into this in other efforts, is designing a sustainable financial model for data sharing. It needs to be built into the work. The work that we did, we encouraged and encountered amazing legal barriers due to the privacy concerns on both sides. It took many years to negotiate the MOU, And to be honest, the project only moved forward because we had some dedicated career staff who kept pushing it as their pet project that they were going to get forward and looking for somebody who would kind of lean in on it. So I would say that across both of these experiences, they feel a bit like one-off, time-consuming interagency matches, and that the most efficient way to move forward is going to be something more centralized that's easier to sustain. So that comes to my third example, which is something that we're doing just now and is a pilot. HUD has entered into 2 agreements with Census that we think will greatly expand access to HUD data and the matching with non-HUD data, and for the approval of internal and external researchers to get access to the data. So the first one is with the Center for Administrative Records Research and Application, so CARA. We have an IAA with CARA that already links HUD's tenant data to other data that are inside the Census research centers. And select randomized trials of our data are being put inside CARA so that outside researchers will be able to do more with them. So in this IIA, the first data set that we're sending over are the MTO data. So the MTO data that everybody is familiar with from the Raj Chetty work, so that researchers can write proposals and get access to it without having, through a secured site. The benefits here are large. I think most of you know and are going to be, I know the Commission will be hearing from Census on its role in supporting your work. This IAA that we've written is the first federal pilot that's kind of proof of concept how a federal agency can do this. It is both on the data matching and on the evaluation, which I think is what you want to keep your eye on here. To jumpstart this, we have HUD is creating its own RFP. We're going to create a small grants program to promote knowledge of this to researchers so that they will come in and use the data. What I would say a lesson here is this is a pilot. It's a proof of concept in which we are ponying up money for doing this. There's an annual cost both to each data set going over, and then there's a marginal cost for researchers. Every data set then would have an annual cost. I've scoped out what this would mean for our trials. It would eat up my entire research budget within a short period of time. So the pilot structure we're doing is a proof of concept, but the group needs to figure out a sustainable financial model if you want federal agencies to participate in this. So the second example I want to use, which, and the MOU that we have with Census is a joint statistical project agreement. This part of what we're doing is to increase access to linked data for internal researchers, right? So the CARA is great for getting external researchers. One of the things we want to make sure we do is we get the linked data so that it's accessible to the federal researchers who know the programs really well and can move program and evaluation data immediately into policy. And so with this IIA, we are committing to doing 4 projects with census data and joint projects over the next year. It is a very important thing to be thinking about when we do this is to figure out how to make sure that federal research staff get access to the linked data. We actually think this is also going to be really helpful with recruiting and retaining some of our highest capacity staff and researchers. We're a great place to come to do cutting edge research on programs. One of the things that we've already learned from these 2, from the matched data agreements that we have with CARA, is how it's playing into our research agenda. So right now we are creating our next 4-year plan. We look at a collection of research questions, and there are questions we probably would not have prioritized, big questions that we couldn't see a feasible or cost-effective strategy for getting done that we're now putting in our CARA bucket. It's like, oh, we can see a way to do this with linked data across and within CARA. So we have a collection of things we're going to get to prioritize now that should be done that might not have made that cut. So I want to make sure I have time to talk about 2 ways in which we think we could make the most of this kind of data linking with CARA. The first is thinking about some restrictions that we have with the way the IRB guidance is currently done. The MTO data that we've been talking about was created at a time for 4,600 families where the consent was not time limited, and it was the consent for matching to types of administrative data were general. So you're able to take the data 10 years later, 20 years later, and match it to data. The family options study, that it would be the second set of data that we're sending over. I think it's our new MTO in terms of what we're going to learn in terms of long-term outcome. It's a randomized trial of homeless families with children. We have a 5-year consent. They are going to be put over in CARA. But if we want to learn about adult outcomes or later teen outcomes, we have to go find those families and do new consent forms. Okay, so if we want to make the most out of our data, we need to be doing something a bit different here. And one idea is that IRBs get some guidance from this commission on consent forms where the data would then be put inside Census and be under Title 13, and think about guidance that we could then incorporate into the way we do IRBs with our randomized trial. A second thing to talk about, we've already touched on, is thinking about the non-federal data that are so crucial for getting evaluation work done. All of our demonstrations take place in locations. We rely heavily on state and local data. For the MTO data, we ran into very varied experiences on the ease of getting those earning data. Worked really well in some places. We still have one state we're trying to get data from so that we can look at outcomes. So there's a second pilot going on at CARA, which has to do with Chapin Hall. They are submitting state and local data from a limited number of places. We could expand on that, and we should think about the data list beyond federal data. I'm going to leave this last slide up as the timer ends. Doubling down on PRA. For HUD, this is critical. Our programs are implemented by non-federal staff. We can't learn about what's happening with our programs without going through PRA. We frequently don't bother. We use anecdotes because we don't have time to learn about something that's going on the ground. We can talk to fewer than 10. And we also think a session just on that would be useful. I will stop before it dings.
Very wise decision, and thank you very much. Evelyn.
Thank you.
Thank you for coming.
Good morning, and thank you for inviting us and the opportunity to present on our efforts to strengthen capacity for implementing evidence-based programs, evaluating teenage pregnancy prevention programs with rigor, and using data to improve our work, all of which are key priorities for the Office of Adolescent Health. At the Office of Adolescent Health, we administer the National Teen Pregnancy Prevention Program, which is a tiered evidence-based grant program. Between 2010 and 2014, we funded 102 grants across the country, each at between $400,000 and $4 million a year for a 5-year grant period. We awarded a total of $100 million in competitive funding to school districts, community-based organizations, universities, health departments, and other eligible organizations. And this funding supported cooperative agreements that included $75 million for replicating one or more evidence-based programs that were proven effective through rigorous evaluation to reduce teen pregnancy, behavioral risk factors underlying teen pregnancy, or other associated risk factors. And this we called Tier 1. It also included $25 million for research and demonstration grants to develop, replicate, refine, and test additional models and innovations. And this we refer to as Tier 2. In addition, Congress provided program support funding and also earmarked specific funding to carry out evaluations of teen pregnancy prevention approaches. To help identify evidence-based programs that were eligible for replication through this program, HHS conducted an independent and ongoing systematic review of the teen pregnancy prevention research literature. The evidence review examined research for study quality and assessed whether program models demonstrated positive impacts on sexual risk behavior and sexual health outcomes. The results from our first cohort were just released this past summer, and we're now moving forward with a second 5-year cohort of 84 grants across the country. Our first cohort used a multi-pronged evaluation approach to address the questions of whether replicated evidence-based programs and new innovative strategies were effective. The approach included the collection of performance measures by all of our grantees, 2 federal-led evaluations, and a series of grantee-led evaluations. A uniform set of performance measures were collected and reported twice a year by all of our grantees, which helped us assess the program's progress in achieving goals, and grantees were also encouraged to use the data to assess and improve their own program operations. The measures looked at things like reach, dosage, fidelity and quality, partnerships, training, and dissemination. 2 federal-led contracts supported individual evaluations of funded program sites. The first, in Tier 1, examined whether 3 program models previously shown to be effective in a single study continue to demonstrate effectiveness when implemented with fidelity in different settings and with different populations. A second federal evaluation in Tier 2 had 2 components: an in-depth implementation analysis of 5 selected programs to examine context and delivery, and a rigorously designed impact study of each individual program. Additionally, grantee-led evaluations were required of all Tier 1 grantees that were funded at $1 million or more per year, and all Tier 2 grantees were required to rigorously evaluate a new or innovative approach. We required that all of the grantee evaluations be conducted by an independent third-party evaluator, and that the evaluations be designed and implemented to meet the research quality standards set in the HHS Teen Pregnancy Prevention Evidence Review. We also found that there are a specific set of conditions that were necessary to ensure that grantee-level evaluations maintain a high level of rigor. And these include sharing detailed criteria for what is considered a rigorous evaluation, including a detailed description in the funding opportunity announcement about the expectations for conducting a rigorous evaluation, involving an independent evaluator, someone who's independent from the grantee organization and independent from the developer that developed the original program model. It's also important to allow for sufficient resources so that the evaluation can ensure power and the ability to maintain rigor. We required grantees to allocate between 20 and 25% of their overall budget for their evaluation. We also placed a condition on their grants to stipulate that continued funding was contingent on meeting the standard sets for evaluation rigor, and we had an ongoing internal commitment to hold grantees accountable to those stated evaluation standards. In addition, we provided intensive programmatic and evaluation technical assistance to grantees to both ensure high-quality program implementation and rigorous evaluation. At the office, we used the evaluation results and the lessons learned from our first cohort to inform our funding and evaluation framework for the second cohort. In addition, it assisted our new grantees in selecting which evidence-based programs they would be implementing this next 5 years. In Cohort 2, we're implementing a holistic approach to replicating evidence-based programs in order to have a much larger sustained impact. Using the first cohort's evaluation data and results, our current set of grantees have had more information on where, when, and with whom specific program models have been most effective. This enabled them to better identify and implement the evidence-based programs that are a good fit and likely to have the greatest impact in their own communities. We also recognize that not all communities are ready to implement evidence-based programs, and so we set aside some Tier 1 funding specifically to provide capacity-building assistance to those who are interested but not yet ready. We have 8 grantees who are now providing tailored community-building assistance to youth-serving organizations in their communities to implement, evaluate, and sustain evidence-based teen pregnancy prevention programs. We took a similar approach in our Tier 2 funding. We continue to support grantees to rigorously evaluate new and innovative approaches, and specifically those designed to reduce disparities and fill gaps in our knowledge base. But we're also now funding 2 grants to foster and support early innovations to prevent teen pregnancy. These are promising programs or technology innovations that need more support for development before they're ready for rigorous evaluation. And the intention here is to bring good ideas to a point where they can be evaluated in a rigorous way. In our new cohort, we continue to use a multi-pronged evaluation approach. All grantees continue to be required to collect and report annual performance measures, and grantees are required to conduct independent evaluations. What's new in this round is that at the end of this grant period, all grantees will be expected to archive their data in a designated data archive that will be accessible to future researchers and may eventually be able to be linked with other data sources. In addition, several new federal evaluations are underway, and the second generation of evaluation activities addresses a more targeted set of research questions to fill the gaps in the current evidence base. This includes a multi-site evaluation study to identify and test replications of commonly used evidence-based programs, to identify and test significant or meaningful adaptations to existing evidence-based approaches, and to identify and test selected core components, key activities, and implementation strategies of common programs. Another study is looking at the feasibility and impact of scaling up evidence-based programs and the mechanisms through which grantees aim to reach the highest risk populations. This project will also identify a smaller number of projects to implement rigorous evaluations, as well as design a rigorous cross-grantee study to assess the effectiveness of this new holistic approach. A third study is an implementation and impact evaluation of commonly implemented but understudied teen pregnancy prevention programs. And then finally, to extract the maximum value from previously funded evaluation efforts, we're also funding 2 additional studies: a secondary data analysis to enhance understanding of interventions designed to reduce teen pregnancy in programs implemented with middle school youth, and then a meta-analysis synthesizing the evidence from across previously funded federal grant evaluations. And this study will examine what program or contextual elements made a difference to youth and their outcomes based on reports and individual level data. I think our experience brings to light several important issues regarding the capacity of community-based organizations to conduct rigorous evaluations, and many of these challenges and lessons learned may have applications for others. We recognize the importance of providing adequate support in preparation for program implementation. Therefore, we required all of our grantees to spend the first 6 to 12 months of their grant engaging in a planning, piloting, and readiness period. This gave them time to identify and make necessary adjustments, staffing, program models before they went to full implementation. We also know that communities need the capacity to implement evidence-based programs with fidelity and with high quality. We found it critical that grantees set up a system for monitoring, analyzing, and using fidelity data for continuous program improvements. We also had some challenges in incorporating evaluation effectively once program implementation had begun. Recruiting sites was complicated by the fact that for most of them, their interventions were not designed to be implemented with the requirements of a rigorous evaluation. We also found it difficult in some circumstances to ensure a strong contrast between treatment and control, given that very large federal grant program that spanned 39 states in the District of Columbia. We're also learning a lot about building capacity. An established evidence review provides a standard yet rigorous set of expectations for future evaluations if a program model aims to be an evidence-based program. Clear communication about evaluation expectations, along with training and technical assistance, help to build the capacity of our grantees to meet the research standards of the HHS Teen Pregnancy Prevention Evidence Review. We also found it critical for us and our grantees to collect data on the implementation of the program and to use that data on a regular basis for continuous program improvements. We think it's vital to disseminate all of our evaluation results in a transparent manner. We know that no single program is going to work for everyone every time, and that null or mixed findings, which are to be expected, are critical for continued learning about which programs and approaches are most effective with different populations in different settings. This July, we released the results of 41 rigorous evaluations, And half of those evaluations have been featured in a supplement in the American Journal of Public Health, and all of them are now contained in reports held in a collection at the National Library of Medicine. And so you can find more detailed information about our program implementation and our evaluation results at these links on our website. And thank you for the opportunity to present. I think I've
Thank you
stayed
very
within my
much.
time.
Well timed. Matthew Klein.
Thanks. I appreciate the opportunity to be here. I direct the Center for Economic Opportunity in New York City. It's a unit of government inside the mayor's office, and we use data, evidence, and design to help the city reduce poverty. We assess the city's existing anti-poverty approaches, develop new interventions, facilitate data sharing across city agencies, and rigorously evaluate the impact of key initiatives. And I'm pleased to offer a local government's perspective on the opportunity here, since obviously there's big implications for the federal government's work in this area. And in particular, the opportunity to make it easier for cities to integrate information from different sources so that we can deliver more effective, holistic, personalized services to our residents. I have the privilege of participating as a local government fellow in the Results for America's program, and through the convenings and knowledge sharing that they offer, I trade notes regularly with counterparts in different cities, and the issue of data sharing and navigating data issues is at the top of the agenda for all of us. So I really appreciate the work of this commission. My recommendations are going to focus on two areas. First, the need for the federal government to continue to model, champion, and support evidence-based approaches, which I know we'll find a ready audience here. And second, the benefit of amending key federal laws and regulations to allow local governments to share data across our own city agencies without client consent for the discrete purposes of providing services, benefits, and care, for program planning and implementation and evaluation, and for using computer matching technology to facilitate these activities. Cities are in a unique space when it comes to service delivery and engaging with residents. We're the closest level of government to programs on the ground, and importantly, we receive direct, candid feedback from our residents. So we know that a key challenge is to engage with residents holistically, rather than through the silos of particular departments who are charged with specific programmatic areas. Our residents, and particularly our most vulnerable residents, engage with the city in multiple ways, and we can be most effective when we are aware of an individual's or family's touch points and coordinate how our various programs work together to support them. And cities are both creators and users of evidence. We're in a position both to build evidence that contributes to the national strategies and also to draw on this kind of work. And so in this context, I want to talk a little bit about some of the efforts we've made at the Center for Economic Opportunity, where we've focused on advancing the use of evidence and data in program and policy design, service delivery, and budget decisions. For example, drawing on federally collected data but supplementing it with New York City-specific sources, CEO established a local poverty measure, one that provides a more accurate description than the federal standard rate. The CEO measure reflects the local costs of New York City, particularly of housing, while also, like the more recent federal supplemental poverty rate, includes the value of non-cash forms of assistance such as tax credits, supplemental nutrition assistance program benefits, and the like. This measure gives city government a clearer picture of poverty in New York City and helps guide our anti-poverty efforts. And our evaluation of those efforts focuses both on new programmatic innovations and also on large citywide efforts. And as this commission knows, evaluation shouldn't be seen as simply a formal effort to issue a thumbs up or a thumbs down verdict on whether or not a program works. Different evaluation activities serve different purposes, and that's been the case for CEO. For example, in the course of rolling out New York City's new universal pre-K initiative, we employed qualitative studies to help us understand implementation issues and identify best practices that can be shared across sites. With the support of the Federal Social Innovation Fund, we are currently launching a new program and outcome study to assess the impact of integrating mental health and social services using a comparison group approach. And we've also employed more rigorous impact studies using randomized designs and cost studies that help us understand the return on investment of an intervention. I'd like to cite a few of these that have been instrumental in shaping policy in New York City. The first is a model created with the City University of New York called the Accelerated Study and Associates Program, or CUNY ASAP. It aims to increase the college persistence of low-income students seeking associate degrees. A 5-year experimental design led by our MDRC research partner found that ASAP students with developmental needs graduate at more than double the rates of non-ASAP students. As a result, New York City is growing the program from its initial test of 1,000 students to 25,000 students, and the model is now being replicated to other cities and being tried at a 4-year college. Another example that we've also heard about already is in the area of workforce, and in particular for CEO, our efforts around sector-focused workforce development programs. We took note of a research which found that sector-based strategies benefit both workers and employers, and based on this finding, New York City launched a one-stop sector-focused career center, at the time using a blend of city investment and WIA funds. In 2013, a 2-year study conducted by our research partner Westat found that compared to standard centers, sector-focused centers, participants are 12 percentage points more likely to be employed in the year after the program, earn 50% more on average than matched career center participants, and that industry-specific training increased earnings by 82%. And these results were instrumental in the city's adoption of a career pathways workforce development strategy that's influencing the way that we're investing citywide. We subsequently launched and tested a work advance program, which has increased employment for low-wage workers in target sectors and increased earnings by an average of 14% or nearly $2,000 annually. Finally, another example showing an interplay between federal and local evidence building is Jobs Plus, which is something we've done with HUD. Jobs Plus is a place-based employment and training program focused on supporting residents of public housing. It combines workforce services with resident-led community-based support for work and rent-based work incentives to help public housing residents obtain jobs or advance in careers. This model was first implemented from 1998 to 2003 through a demonstration funded by HUD with an RCT evaluation by MDRC. It found Jobs Plus increases public housing residents' average earnings by 16% when fully implemented, and that these findings persist over time. CEO piloted the first NYC Jobs Plus site in 2009, expanded it again with support from the Federal Social Innovation Fund in both New York City and San Antonio, and lessons from this implementation and evaluation are now informing HUD's more recent iteration of the federally funded Jobs Plus program. I also want to talk a little bit about the intersection between evaluation and administrative data that's used in a more real-time basis. Since, as this group knows, getting good results involves more than implementing a model that was shown to work at one time. We need ongoing real-time feedback from data. And administrative data can be crucial on this front, especially when we have it readily accessible. So among the major steps that we've been taking are launching what we're calling a citywide data integration initiative, which is making data accessible with the appropriate permissions and protections through a platform that draws from our agency's own administrative data. So very much along the lines of what you've heard recommended on the federal front. And the overarching purpose of this initiative is to facilitate a one-city approach to program planning, development, and service delivery. The ability to capture data longitudinally, as you've heard, linked across sources with clear documentation is critical for this to work. And I want to particularly point out for those thinking about how to organize this at the federal level that at the city level, the Mayor's Office of Operations has proven critical in leading the effort, notably because of its historic role as a performance arm of the city. And so locating data integration centrally with the body that's charged with performance management for the city, I think has been critical in helping us advance the initiative. And also, of course, the technology platforms have to be secure. We need to comply with regulations of HIPAA and others that demand confidentiality and privacy. And so working with all of New York City's technology partners, that's been something we've been focused on and committed to doing. We have other tools in place that allow caseworkers to see integrated case files of clients drawn from a number of different sources. It's different than a longitudinal warehouse of data, but very useful for on-the-ground implementation. And finally, under our Common Metrics initiative, we've launched, engaged on something that I know you've heard about also, which is to define outcomes similarly across different agencies. That allows us to make better relative comparisons and compare an apples to apples when looking at things like workforce development, where things like job and placement can mean different things depending on the funding stream. So finally, let me quickly skip to a recommendation beyond just championing the furtherance of this evidence-based approach and focusing on common metrics, to say that federal law should be amended to give local governments more freedom to share client information among its own divisions and employees. Many of the laws that were designed to protect individuals from having their privacy compromised, and that's appropriate. But federal laws and regulations should draw a distinction between a privacy invasion and a use of data by a city internally across its departments without client consent for, as I said, the purposes of providing services, benefits, and care, for program planning and evaluation, and for using computer matching technology to facilitate these activities. Among the most valuable changes would be amending regulations under HIPAA to create new legal exceptions that authorize city agencies to share information with each other when providing or coordinating benefit services and care. This would give New York City and other cities more flexibility and clearer legal footing to meet specific needs of our vulnerable populations. So, for example, under existing regulations, it's not clear if our city's hospital system can legally share identifying patient information with the Mayor's Office of Criminal Justice, a non-HIPAA covered entity, for a data match that we want to conduct to identify homeless individuals with a history of incarceration who are in need of supportive housing placement and could be placed in limited supportive housing slots. I think similar clarity and exceptions in FERPA would allow us to do things like better target youngsters for inclusion in services that could benefit them. And finally, in a wide array of areas, allowing us to conduct computer-based matchings without labeling that match as a disclosure would facilitate faster, better use of administrative data by implementing local agencies. So with that, I'll stop and, again, appreciate the opportunity to be here.
Thank you very much. Commissioners, questions? Bob? Oh, I'm sorry. No, Bob? Bob, then Catherine.
I want to follow up on Matthew's comments. A couple of things about the data integration. I guess three things, sorry. One, you've heard your prior presenters talk about difficulties of cross-agency work. I'd like you to reflect on that a bit. Secondly, I'm a little confused about, in your uses, whether you are making a distinction between statistical uses of data and program uses of data. And by that I mean the first being completely uninterested in an individual record, and the second being intensely interested only in individual records. Could you comment on that?
Sure. Well, I'd echo the challenges that I think I've heard expressed about doing cross-agency data integration. The challenges come in three forms. One, just programmatic. What questions are the most important questions to ask? Second, technical. The technology, as everyone knows, is advancing rapidly. Data is exploding. But many of our systems aren't keeping up with modern advances. And so being able to take advantage of new data sharing technologies in conjunction with legacy data systems is extremely complex. And so part of, I think, the solution going forward is to think about, on the technical side, what the appropriate requirements should be for new builds and government's procuring of technology. And I know that there's a lot of work being done on that front. But lastly is privacy and legal challenges, which add to the complexity of the other two, because in order to integrate data from multiple sources consistent with privacy laws, which are sometimes explicit and sometimes ambiguous, it's both the process to negotiate the legal interpretation of that, those privacy restrictions, and then to build a technology that can accommodate what you can and can't do and who can see it and who can't. And so to that point, I'm speaking mainly about that individually PII data, the individually identifiable information, the personally identifiable information that really can help a city do sort of the ideal of connecting the right program to the right person at the right time. And to do that, we want to know, again, consistent with protections and responsibly, how our residents are engaging with the city and how we can better coordinate those agencies that may not know they're working with the same family, or to send an alert from one agency to another if someone enters a particular system. So there's just a lot of innovation work that we can do around the delivery of services if we can draw on the totality of the data, and of course then measure and see what works and so forth.
Catherine.
So I had a question to follow up on some of what Catherine was talking about. If I understood correctly what you were describing with one of your examples, HUD is now planning to send some of its data over to CARA, where they would reside and be generally available for research and evaluation uses. One of the reasons why assembling data from different sources is so difficult is because the places where the organizations where the data are originated are unwilling to give up control over who's going to get to see them and how they're going to be used. If I understood what you said, you sort of jumped over that hurdle. And I'm wondering if you could talk a little bit more about that.
Sure. So one way to jump over the hurdle is we have not totally given up control. So our data, and the MTO data being the first, we've made the MTO data widely available to researchers, but have not had an infrastructure for doing that. So it's been piecemeal. By having those data over at CARA, researchers can then apply with projects. But we would be able to approve or disapprove a project. HUD has been very, there are, well, I can tell you it's a lot easier to get this signed and done where there's a process where it wouldn't just be, at least at the starting, right? We have something that's called data licenses, which is that we make our data available to researchers through a process that where they send us their information on the data that they would like. And so you'll see lots of studies where microdata on voucher households have been matched to other data. They don't have PII, but they have an address, they do something. We do it under a data license. This is something that we could think about doing through the infrastructure at CARA. They do apply and have to tell us what they're going to do. A main part of what we focus on in that is that they're researchers, right? Sort of the privacy component. So I don't expect that the fact that the proposals are going through us will lead to research projects by researchers being denied access to the data. And in the tee-up, we're putting some money on the table to cover the cost of access to CARA for some subset of them, but we're expecting we'll get a bunch of projects that are all approved, 3 of whom we can fund, and the rest of you can go get some foundation or just pay for it yourself, but click, you have access to the data.
Just to follow up, can you imagine a scenario where you would lay out a set of criteria for what projects were approvable and delegate that to CARA, or do you think that's just beyond what you could think about at this point?
I actually think it might be faster for us to get it done. Nothing against the census, but we've been doing this kind of piecemeal with data licenses. We take the work off our plate for the infrastructure and the data pieces. And what CARA does is all of the special sworn status, in addition, right? So anybody who's going to be accessing the federal statistical data goes through that process. They work on that part. We just look at the proposal to make sure that this is actually a research proposal for which the data are appropriate. They do not have to go through the type of, if the key data they're getting access to are our data, they do not have to do the type of census proposal and go through the review committees for census. So we can just sign off very quickly on the proposal. They do the special sworn status, and the researcher gets in. So given the experience some researchers have had with having to go through the special sworn status part through census, we believed we were going to be able to portray this as a faster process by the way that we're handling it. But it's a pilot. We could imagine very much going in a different way after we learn from this round.
Bruce, then Paul.
I'll be very brief. I just want to thank Catherine for submitting the 6-page supplement to the slides that answered my questions about the PRA and about the limits of the Privacy
Great.
Act.
Yes, the testimony is longer than the slides.
Well, that was good. Paul.
So my question will be much longer than Bruce's, but it's, so I'm a privacy law scholar. So this was very new and informative to me, so thank you all. So the one question I've been having for a few meetings now is, so I'm also a computer programmer and computer scientist. It seems like a lot of the work you're talking about, please correct me if I'm wrong, is ordinary kind of old-fashioned multivariate regression and other kind of econometric tools. I haven't really heard a witness yet talk much about around-the-corner machine learning techniques. And so one question is that something that is beginning to become part of the evaluation landscape? Number two, for our purposes, does that raise new and different data management and data access questions that this commission ought to be considering? Or should we instead just focus on rather orderly tables that get linked in rather traditional ways, as opposed to kind of, I need all the data and I need it now sort of mindsets that machine learning tends to engender?
I can speak very quickly, and then I'll be at the outer bounds of my knowledge on it and pass it on to Matt. So not within the data matching component of what we're talking about here, with our own administrative data inside HUD, which comes from arcane systems with different variables and a whole collection of stuff, we're moving in that direction of something like a data lake where we would be able to be doing more machine learning. But we're at the forefront of doing that and working now on designing that. But that would be just for our data systems at this point, which are massive enough that would be very helpful for our program work.
I'd echo, and I'm at the same boundary. But I'll give an example. I think we're at just the beginning of the machine learning, but and predictive analytics and all are things that we care a lot about, and are trying to build the capacity which requires some of these more modern data ingestion techniques. I'll give an example of one problem that we are engaged potentially with outside researchers to think about, which is using wage records plus data that we have about folks' work histories to help newly unemployed make decisions about whether or not to take offers as they get them by learning from the experience of the tens and hundreds and thousands and millions of folks who've come before with similar profiles and how long it's taken them to find work. And so that could help inform the kind of decision making that someone might want to make. There's there's enormous implications, of course, to all the algorithm-based decision making, and so. But I think there's broad excitement about utilizing it, and it does speak, I think, to the implications of allowing things like matches and the updating privacy laws that were created before the advent of machine learning kind of techniques, which you would know much more about.
Thank you very much for those presentations. They were very helpful. Just as a follow-up to what Paul mentioned, I see machine learning as just another tool. It's the same data that we would all want to leverage with a machine learning technique rather than a different kind of evaluation technique. But I wanted to follow up on one thing that, Catherine, you talked about near the end of your presentation, mentioning something about differences in IRBs that were the MTO IRB that had an open-ended consent that allowed for this long-term evaluation without having to go back to the population. But then you talked about a new project you're working on with a 5-year consent. So can you talk a little bit about that?
So the IRB.
And what is guiding those different outcomes?
So for the evaluations that we do as we work with, through a procurement system with outside organizations, everybody has an IRB board, and the recommendations and constraints that come in are set by their IRB policies. And there's been movement over time for privacy and a variety of other reasons for the IRB boards to have more restrictive, place greater restrictions on consent forms. And so where we are now, the randomized trial that we're doing with the homeless families, the restrictions are a 5-year restriction, and that is common across our current randomized trials. And that is different than not just MTO, but we've gone back and looked at some of our older randomized trials, and we would be able to do something like MTO, where we'd be able to take them in and look forward beyond for quite some time. And so it would be good to hear from other federal agencies, and maybe we'll get it on the list, the 5 things list. But if what we had from this commission was a discussion of the benefits for evaluation of looking at long-term outcomes, that we have now learned this, and if the Title III census structure and protections are going to be over the data for that purpose, would it be possible to extend the time period or the breadth of administrative data under that rubric? We would be able to incorporate that kind of language into future IRB consent forms, working with our outside evaluators. That's what I had in mind.
Yes.
Right. It'll be quick, right?
Good.
Thank you, Catherine, Evelyn, and Matthew, for your presentation. Something that, and I was going to ask Demetra, but we ran out of time. In your evaluations, do you also do a cost-benefit analysis? That's part of it? And do you have a formalized process? Because that's part of this commission, is to look at cost-benefit analysis as well.
So I can speak on behalf of us. So earlier, I think, Matt, you were talking about the fact that different types of evaluations have different roles. So it wouldn't be true for every evaluation you would want to do a cost-benefit analysis, because that's not the type. As an example of the family options study, in looking at outcomes, an important piece of that work was it also looked at the different costs of different types of interventions. It is not at the level of a formal cost benefit, since it's early stage. So we are at the point now where we have 3-year follow-up data, where we have information about the housing stability and some decreases in adult stresses and mobility across school for kids. We've got some good information about behavioral problems with kids. You could do a back-of-the-envelope cost benefit from the cost that we've seen, but you'd have to play out those benefits, which are different than the housing benefits that we've looked at. But that is a key piece of the impact studies that we're doing, is to make sure we get the cost to be able to do that type of assessment. Not uniform.
And in the Teen Pregnancy Prevention Program, we've started to look at cost issues. We've seen that in the implementation of evidence-based programs, great variation in grantee costs for implementation. So we've done some internal work to look at why does it cost one grantee a certain amount to implement the same program versus another grantee. We haven't gone as far as cost-benefit analysis, but it's part of our early work in terms of understanding the costs of the actual program implementation.
Matthew, I think we have time for about a 2-word answer here. It's a very broad question. You talk about, and several other people that I know have done the same thing, I'm not sure before the commission, but about the ability, at least within the agency, to share personal data without any sort of permission form would greatly facilitate things, which I'm sure everybody would agree with. Do you have any experience with the politics of that? Is it public that you want to do this? We had a witness that came to our open hearing who said he didn't think that we should even have individual data. Educational researchers had a near-death experience with FERPA a couple of years ago. I mean, this is really concerning that we would broaden access without getting permission from individuals. So do you have people complained about that? Have any city council had a fit or anything like that?
Yeah, I don't know if the city council has had a fit. I know that the question of student data privacy is significant in New York City, and elsewhere, and in particular, that can be tied to the fact that educational technology products are private companies that are utilizing public data. I will say, you know, and so I think the purposes for which you would share data without consent need to be clearly articulated. But there are exceptions to FERPA and HIPAA and others that allow one to do that. And and in particular, you think about outreach campaigns as that being particularly useful. Oh, this person is qualifying for this program, but we don't think they're getting that program. Let's let them know about it. And so we do campaigns, including calling folks about that. And I will tell you that the folks who are on the other end of the call are grateful to be told about the opportunity. So I think they're legitimate concerns, and I think, you know, we'll grapple with them. But the purpose and being explicit that the purpose is allowed is a real advance that I think this commission could produce.
Okay, and with that, let's take a break. Okay, so we're on break for 10 minutes. We'll start again promptly at 10 minutes after 10. Thank you. Thanks to our witnesses. Great testimony and answers to questions.